about two other skin conditions that are a little bit more tricky. And the first one is ringworm. Now, when your baby starts nursery and they are in close proximity with other children, they tend to pick up all sorts of skin rashes, colds, flus, everything like that. So the two skin conditions that I'm going to talk about this evening is nothing to do with poor hygiene. So please don't be worried if your baby or child does get ringworm or scabies. That's what I'm going to be talking about today as well. It's completely normal and it is nothing to do with you or a reflection on your parenting. So what is ringworm? Well, ringworm is a fungal infection that is picked up in close proximity when you have lots of babies together. And we don't know quite why it's picked up, but it is quite contagious and it can go through the whole family. Now, the way that you'll recognise it is it's a very characteristic in that it's circular in how you recognise it, and it's slightly elevated off the skin and can be red in colour. Now, the treatment is very easy. All we have to do is to apply an antifungal cream. But you do need to make sure that you wash all of the bed linen and any towels that your baby or child has used to make sure that you get rid of the fungus, really, because it can lay in towels and in bedding. So very easy, very simple to treat, and it can spread to other family members. So sometimes we do need to treat other family members as well. So let me talk a little bit about scabies. Scabies is a mite that burrows under the skin, and it lays its eggs, unfortunately, under the skin, and it comes across as little pinprick kind of rash on the skin, and it normally is in a line where the mite lays its eggs. Now, characteristically, you will find these scabies starts in between the fingers. It quite likes being in between the fingers. And you will also find them sometimes in the nappy area and in the groin. And they cause intense itching for the child and can be very uncomfortable. Now, the thing with scabies is it is highly contagious and it can spread throughout the family. So again, you need to have treatment with it. It's not going to go away on its own. There are some homeopathic remedies that some people will use, like aloe vera and cayenne pepper. Some people have used zinc, but I don't really recommend any homeopathic treatments. It's much better just to go to the GP and get the right prescription. It's a lotion that you put on your child, and within 24 hours the itching is significantly better, but you do have to do a second treatment 7 days later. And you will have to treat all members in your family. And again, with things like this that are contagious, you need to wash all the bed linen and all of the towels that you use with your child. But again, it's very simple and easy to recognise. I will pop some pictures in the post for you, underneath this post rather, so you can see what it looks like. Hopefully it won't bother you too much, but it's important to be able to know how to recognise it. So those are my two skin conditions that I'm talking about this evening. But I did want to answer some questions. I had one question that has come in about sleep, and it was particularly to do with daytime naps. Now, this particular baby was 9 months old, and there was difficulty in getting him off to sleep in the daytime. Now, naps can be much trickier to get your baby to sleep in the day than in the evening time. And the reason being is that the melatonin, which is the sleep hormone, is lowest in the morning time, and cortisol is quite high because cortisol is important for getting us up and at 'em really for the day. But melatonin will build throughout the day, and it's highest at night time. So it's much easier to get your baby to sleep at night than it is in the daytime. But what will really help with daytime naps is having your child to sleep in daylight, because melatonin levels, getting out in the sun, really does help the levels of melatonin, and they are highest at around lunchtime. So that's probably around the time when you're getting your baby off to sleep. So I would recommend that you leave your curtains open during the daytime to put your baby down to sleep, because that will help the levels of melatonin to rise. Now, you might say that's easier said than done, and my baby in no way is going to go asleep with the curtains open. But of course, many of our babies go to sleep in the car when we're out in the day, or in the buggy during the day, and it's bright sunlight then. So it's no different inside, but I can appreciate it, that it can be tricky. Now, babies of this age need about 13 hours sleep. So most of this, about 70% of it, will be taken at night time, and the other 30% will be taken during the day. So that's about 10.5 hours at night and 3 hours in the day. But of course, if your baby is having 12 or 13 hours at night time, then they're not going to require the daytime naps. So it very much does depend on what time you put your baby to sleep. And I know some babies will go down at 6 or 7 o'clock, so they're going to wake up the next morning at 6 or 7 a.m. and that's going to be 12 hours, or if not 13 hours. So they may have got their sleep quota in at night time and may not require daytime naps. Now, I don't know the personality of your child, but some babies are just much more active than other babies and don't require naps during the day. And I can appreciate how difficult that must be, because a baby is really demanding, and sometimes we're just wishing for them to be able to take a nap in the day so that we can get a rest. But unfortunately, if your baby doesn't want a nap in the day, there's very little that we can do about it, as long as they're not becoming overtired and showing signs that they really want to sleep. And these signs really are, rubbing their eyes and yawning, being irritable and cranky. And if they are showing those signs, then of course we do need to put them down for a nap. Now, getting your child to sleep during the day, things that help are transitionary objects or comforters. So if your baby is breastfeeding, I would always recommend that you try and get the scent of your breast milk onto a comforter, whether that be a muslin or a piece of your clothing. It really does help to condition that muslin or piece of clothing with your scent on it, and have it with you when you're breastfeeding your baby, or indeed wherever you're going. So it can build up an attachment for your baby and make it easier for them to go to sleep and have naps during the day. But without really knowing your child's personality, as I said, and how long they are sleeping at night time, I'm just giving you general guidance and support to help you and give you some tips and hints to make daytime napping a little bit easier. I know there was another question that came in, but I actually can't remember it, and it's somebody who's quite new to the group. So if you want to, please post that in. I will cover that tomorrow. So I haven't got anybody who's joining me this evening, and that's absolutely fine. But going forward, I will be doing a live at 7 on Sunday evening, and that's British summertime, and I know some of you are in Canada and in America and various other places in the world, so you may not be able to join me, and that's absolutely fine. But if you do post your questions, I will certainly answer them for you. So I hope you've had a great week, and I look forward to catching up with you in my next live. Until then, happy parenting, everybody. Take care. Bye bye.